What's most important when considering surgery for rotator cuff tears is that the indications are proper, that you have a full understanding of the postoperative rehabilitation and the anticipated outcomes. Fortunately, most patients who undergo rotator cuff repair have a good or excellent outcome. We currently are actively involved in research investigating adjuncts to rotator cuff repairs with something we call orthobiologics. Now, as a patient, you may be seeing signs for stem cells and platelet-rich plasma, and all types of things that profess to sort of rewind the clock and change the structure of tissue. We use orthobiologics such as bone marrow concentrate, which may have stem cells in there, but bone marrow concentrate is actually a source of growth factors that can potentially reduce re-tears. So we focus less on the presence of a stem cell, which in this setting doesn't actually function like a stem cell would, say, in a test tube, but the cells themselves that we can get from bone marrow aspiration, where we take bone marrow through a needle that you wouldn't feel at the time of surgery. We spin it down in a centrifuge to get an elevated aliquot of platelets and cells that produce growth factors, is that they might or could reduce the re-tear rate at 1 year follow-up. There is one highly quoted published study that showed a substantial reduction in re-tear rates by MRI or ultrasound at long-term follow-up after rotator cuff repair when these bone marrow concentrates were used at the time of surgery. We too have completed a study that showed a slight reduction in re-tear rates at 1 year when patients who underwent a previous rotator cuff tear had an MRI to assess the integrity of the rotator cuff. Anecdotally, we believe it might also reduce the postoperative discomfort that patients have. Other than the financial commitment, there is no downside to adding bone marrow concentrate or platelet-rich plasma, an additional source of growth factors, at the time of surgery. This is a discussion that we should have at the time of scheduling your surgery to see if you have a level of interest to utilize this investigational or experimental procedure as a way to potentially reduce re-tear rates and potentially improve the postoperative recovery process.